I am excited to show you and talk to you about this Lidocaine patches. You could get this over the counter. It's on Amazon. Why this is a nice product is because if you have any aches and pains, if you have any sort of wound, like even a surgical site, you could put this around it, and I'll show you how. We use this in the hospital. I'm a nurse. I give these to my patients. This is 4% Lidocaine. In the hospital, and like prescription strength is 5%, okay? So it's a 1% difference only. So these patches, you could cut them up and put it around like the site. Like I said, they're great. They numb the area. They help bring numbness and just kind of relieve you from that pain. This is how many you get, okay? So this box has 36 patches inside, and they all come pre-wrapped, so they're perfect for travel. Like if you're out and about, if you're at work, if you're going somewhere, just like the ones at work, they won't tear off. You need to use scissors. It looks exactly like the ones that I have at my work with the same type of backing and everything, okay? So you could use this whole size. If you don't need such a big size, or if you want to kind of put it around specific sites, you could cut this. It has this clear backing on the back. This is soft, and you could cut it and make it into a smaller size. So I'm going to show you. This is a surgical site, incision site. Sometimes they're even bandaged up so you can't see it, but you know, it's painful around there. The skin hurts, everything hurts around there. So what we do at the hospital is obviously you never want to apply directly on any open wound, any cuts, anything like that, okay? So intact skin, but if this hurts and you want to put it around it, what I would do is I would even cut this in half, and half here, half here. So I'm going to show you what that would look like. Lengthwise, you could do any way you need to for your problem area, and then the backing just comes out pretty easily. You can see how that is. It's sticky on the back. And then I would just put it as close to the incision site. So like that. Obviously that would be stitches, so you don't want to get on top of the stitches or anywhere near this area. And if it's bandaged, still around the area. We're gonna just apply it to this other half, this other side of it. So that's one way you can apply a Lidocaine patch, okay, around a specific site. So this works wonderful. If you have, like, for example, knee pain, joint pain, so I would just put it on here. You can apply this whole thing just on there like that. You could put, say it hurts and you don't want it quite on there, you could cut this guy in half this way. Apply half down here, and you can apply the other half to up here. Say you want to just use one patch and you have all these sites, you know, so say I want to use it like that, so you could apply that way, and that way it's not bending and it's not annoying your knee. For me, I get a lot of like hip pain. I would apply the whole thing just to the side of my hip. You can use these guys. Do you ever get like that tension from typing or sitting on the chair on your back? You can apply it right here. Cut it in half even, apply half here, the other half on the other side. For children under 12, you would want to consult your doctor, make sure it's safe for them to use. 12 and older, you could definitely use this. This particular package says to take it off after 8 hours, and you would just want to use one in a 24-hour period. I hope this helps, and anyone that's trying to stay away from any sort of pills and medications, because you know, it beats up our kidneys and our livers and our stomachs, especially the anti-inflammatory ones. We don't want to abuse if we don't need. So I would start off with something like this and work your way up.